Hi, my name is Dr. Nguyen. I originally am from Vietnam, but moved to Texas when I was young and grew up there. And then I moved to North Carolina for college. I went to Duke for undergrad and then med school and residency. And I felt like after all of that, the beach was calling my name. So I interviewed all over North Carolina. I knew I wanted to stay in the state. And then stumbled upon these lovely folks that I now get to work with today. And I just felt like I found family immediately. I decided to choose OB/GYN because I really enjoy being with women for the long term. From adolescence, getting their first period, to if they decide to have kids, and then to when they go through menopause. I think it's a really lovely journey to get to walk alongside women with. And I also love OB/GYN because it's a good combination of both medicine and surgery. So for example, with people with abnormal bleeding, I can offer medical management options for them, but if that ends up not working, I can offer surgery too, and we can also take care of it in a lot of ways. And I like being able to offer the full set of solutions for people. Many women have pelvic pain, so if folks have it, they're not alone. The most frequent causes of pelvic pain that I see are often things like endometriosis, where the glands of the uterus grow in places that are not the uterus, causing pain. The glands belong inside the lining of the uterus, but when it grows in other places like your pelvis, it can sometimes grow in bowel or even the bladder. It can cause really painful menses. And thankfully we have good treatments for it, including some medications. Sometimes birth control options can be helpful. And then if that doesn't work, we can also offer surgery as well. Other causes of pelvic pain can be a dysfunction of the pelvic floor muscles, and things like physical therapy can help with that. But those are typically the most common causes of pelvic pain that I see. If women are experiencing pelvic pain that is not responding to over-the-counter medications like Tylenol and ibuprofen, that is a yellow flag, and that's a reason for women to schedule an appointment with their OB/GYN so that we can make sure there's nothing more serious going on. Pap smear screen for cervical cancer. The timing of pap smears really depends on women's medical history. For the average woman, typically we do pap smears every 3 years until they reach age 30, and then afterwards do pap smears every 5 years until age 65. But if there are other conditions, like if women are immunocompromised or they've had exposures to certain chemicals, that might be a reason why we might do more frequent pap smears. So annual exams are really helpful for us to be able to do a whole head-to-toe evaluation, make sure everything is functioning the way we expect it to. We do a breast exam, make sure there's no new lumps, bumps, masses that we're worried about. We'll do a pelvic exam, including looking at the cervix and the pap smear if it's time for a pap smear. We offer STI screening, that's screening for sexually transmitted infections. We'll also do an exam where we feel the uterus and ovaries, make sure that the size is normal, that make sure folks aren't having pain or any symptoms that are concerning. Women should be getting the HPV vaccine. They can get it starting at the age of 9 and then up to age 26, but some insurances still cover it up to age 45. The HPV vaccine is super important because the HPV virus, the human papilloma virus, puts women at risk for getting cervical cancer, and the vaccine protects you against that virus, which then protects you from getting cervical cancer in the future. My best advice would be to continuing doing those monthly breast exams. I recommend doing it in the shower. If you have questions about how to do it, we're happy to talk you through it at your next appointment. I also recommend taking a vitamin every day. I recommend exercising for 150 minutes a week. Usually that's 30 minutes a day, 5 days a week. And then getting your annual exams with us. If you have any other issues that come up along the way, we're happy to see you more often than that too. I practice at Novant, Brunswick, OB/GYN, and Midwifery. We have a couple of clinics all over Brunswick County. I personally practice in Leland, Southport, and Bolivia, and I would be super excited to get to counsel anyone on their medical and OB/GYN needs.